Hi, this is Dr. Homer Lim, and you're listening to your Holistic Health Podcast.
Today we'll be talking about hormones as well as andropause and menopause. Okay, so a lot of people have been asking me or consulting in regards to their problems. Okay, so a lot of people, especially women, okay, when they reach a certain age, some of them in their early 40s, some of them up to the early 50s would develop some form of hormonal imbalance, which is signified by the loss of their menstruation. So that's what we call menopause, right? So that's a big problem, especially for women, right? Because when they start having menopause, usually they would develop some form of heat, hot flashes. Okay, some of them would become irritable. Some of them feel depressed. Some of them would even say they actually become crazy, right? So because this the reason for this is because the sudden withdrawal of their hormones, their female hormones, specifically their estradiol or estrogen, as well as progesterone. So as we age, especially among women, okay, but this doesn't only it's not exclusive to women. No? Men also develop what we call andropause, which is the lack of testosterone. Okay, so let's get back men later. I think it's a bigger problem among women, especially when they have problems with their hormones. Okay, this is a very how to say. Sometimes it's embarrassing for women to talk about their hormonal imbalance because they feel that because I'm old, so they're kind of shy or they're embarrassed to talk about what they feel when they are in their menopausal years. Okay, so the reason for this is as we age, okay, or especially women as they age, the amount of hormones that they would produce will slowly decrease, right? Especially their estradiol or estrogen and progesterone. So the balance or the cycle of having high estrogen, then low estrogen, high progesterone, low progesterone would actually diminish. Okay, in such time wherein there would be a time or an age wherein literally they will not be able to produce any more estradiol and progesterone. Okay, so a lot of women, and doctors also, they're afraid of giving what we call hormones, right? Because the thinking, the premise is if you do, let's say you're on menopause or you're having difficulty sleeping, you're having hot flashes, you're irritable, nobody seems to be able to understand you. So the reason for this is because the sudden withdrawal of the hormones, right? So the problem with this is because of this symptoms, they don't know what to do, right? So some of them, literally, the word is some women actually literally, I feel I'm going crazy, and you cannot blame them because the sudden withdrawal of these hormones is really hard for them, right? So what should we do? I mean, for in the medical community, what are we doing with regards issues wherein women are in menopause, right? So a lot of doctors are very wary or they don't want to give hormones, especially if you're already in your menopausal years, because in their mind, I'm sure you've seen doctors already. Some doctors are not so keen on giving hormones because of the association of giving hormones and cancer, right? But there are what we call the synthetic hormones and the what we call bioidentical hormones and the synthetic hormones. Okay, so the earlier studies that came out, they were using what we call synthetic, or in fact they get it from it's called conjugated equine estrogen, which is actually derived from horses. So these are what we call synthetic because that's not normal. That's a horse hormone, not a human hormone. So now there are newer studies now coming out wherein actually bioidentical hormones, specifically estradiol and progesterone, actually not only improves the quality of life of women, actually protects them from diseases. Okay, so what are some of the diseases associated with menopause? The number one is, I'm sure everybody knows, is osteoporosis, right? But aside from osteoporosis, the more important issues aside from osteoporosis, because osteoporosis takes time, so you will develop osteoporotic fractures if you fall. Usually, when you're in your 60s, right, in your early late 50s, you may develop osteoporotic fractures if you, let's say, you fall. However, the more pressing issue when you do develop when you are in menopause is the higher chance or the higher probability of having a stroke or heart attack. Okay, so a lot of people might not know this because your estradiol, okay, your female hormone estrogen or estradiol actually is protective, protects you from having a stroke or heart attack. That's why you might see, women in their early 50s, right, mid 50s, they would suddenly develop a heart attack or a stroke. That's because of the sudden withdrawal of estrogen. Okay, so actually bioidentical hormones or bioidentical estrogen given in the right manner and in the right dose can prevent early risk of heart attacks and strokes. Okay, so aside from osteoporosis and heart attacks, women also might develop, they would have a higher chance of developing what we call dementia. Okay, so also estrogen also is part of this protection, wherein estradiol actually protects women from developing osteoporosis, heart disease, and or dementia. Okay, so but of course, the most important thing is you have to balance at the same time cycle. You cannot just take estrogen for the rest of your life. There has to be some form of balance. So you have to balance it with progesterone. So similar to estradiol, progesterone is also protective in women. Okay, actually, progesterone protects you from developing late diagnosis of breast and uterine cancers. Okay, so a lot of people don't know that, and but it's true. They found out that women on progesterone, whether they are in the early or late stages of their cancer diagnosis, whether it's breast, ovarian, uterine, are actually have a better prognosis. Okay, so it means that they live longer. Okay, because of their progesterone. But again, you have to understand. You have to be prescribed properly. It has to be done in a proper manner. You just cannot just take progesterone and think that everything will be okay. You have to cite estrogen and progesterone properly. Okay, so these are some of the things that we have to consider when we are in your menopausal years. Okay, so right now, I would see a lot of women, they're doing what we call their BHRT or bioidentical hormone. It's just because they want to look younger. Okay, but I think the more important thing is, aside from looking younger, it's really the protection from heart disease, stroke, fractures. Women when they develop fractures, whether it's from the hip, or the femur or their long leg, their lifespan becomes shorter. Okay, so it's really, for me, given properly, bioidentical hormones really help improve a woman's quality of life. So it's not just about being beautiful or staying younger. It's really about protecting your heart, protecting your brain, and protecting your bones. Okay, so that's for women. Okay, now for men, a lot of people might not realize it. When some men, especially in their late 50s, early 60s, they start developing not loss of hair. Okay, actually, loss of hair is a sign of high testosterone. Okay, but those who have low testosterone, men who have low testosterone, actually starts having some signs of depression. Some of them would have irritable, they become moody. Okay, so even men would develop what we call andropause. That's because of the lack of testosterone. So also, again, a lot of doctors are very afraid of giving testosterone to men who really needs it. Okay, so because again, the fear of having prostate cancer, because there have been studies showing testosterone might increase the chances of prostate cancer. Okay, but actually, it's the opposite. The lack of testosterone actually can be a sign of the prostate cancer could be a sign of a low testosterone. It's rather than testosterone, it's actually in men who are in andropause, especially if they are, fat, they have big fat bellies, right? They're actually producing a lot of what we call estrogen. Okay, so even men produce estrogen. So if you see men with big bellies, they're very fat. Okay, they are not only producing testosterone, actually they are also producing what we call the estradiol or estrogen. Okay, so actually they found out men with higher estradiol are actually the ones that are higher risk for prostate cancer. Okay, not testosterone. Okay, so I think this is a misconception among people and among doctors with regards to testosterone therapy in men. Okay, so because people might say, "Oh, you're on testosterone maybe because you just want to be feeling macho." Okay, but actually that's not true. Same as in women, the lack of testosterone actually can make the men, become at higher risk of developing dementia. Okay, so that's why it's testosterone, just like in women, which is the estradiol. In men, testosterone is very, very important. So you have to understand that even though you might develop some signs of hormonal deficiency, okay, not an imbalance anymore, because literally it's a deficiency. You can mitigate or you can balance it out. You can either take herbs that might balance out or improve your hormone function, or you might actually need some bioidentical hormones. But of course, prior to doing hormones, of course, you need to do some blood tests, some scan, some X-ray, just to make sure that everything is okay. Nothing major issue that might come up, right? So again, in men, if it's really a big issue with regards to becoming irritable, they always fight with their wives, right? So it could be a sign of testosterone deficiency. Okay.
Now I will read some questions from our listeners and answer them in this segment.
If you have myoma, okay, so actually for myoma, the issue with myoma is because you have higher amounts there's an imbalance of your estrogen and progesterone. Okay, so if you have myomas, you have endometrial cyst, ovarian cyst, breast cyst, that could be an overproduction of estradiol or estrogen. So that's what we call estrogen dominance. Okay, so how do you handle myoma? Then you have to make sure that you block the production of estradiol, or you increase their progesterone synthesis. Okay, so you can do that by giving certain herbs, not necessarily giving hormones, no? But so usually myoma, whether it's myoma, endometrial, ovarian cyst, breast cyst, this is a dominance of estrogen. Okay, so the way to deal with this is to increase your progesterone or decrease your estrogen secretion. Okay, is it true during menopause the myoma will shrink? Yes, actually, again, because of the lack of estradiol already, your myomas, your breast cyst, your ovarian cyst, your endometrial cyst will all shrink, right? Also with women, when women in menopause, they actually start losing their height, right? They become smaller and smaller, shorter and shorter. That's because their bones start losing calcium, right? So when you lose calcium, your bones become smaller and shorter. So actually, women will develop some form of their height becomes shorter, around 1 to 2 inches. Okay, so that's also one issue with menopause. You will have a loss of calcium in the bones. Therefore, you will start having loss of height. Then you have to wear higher heels, right? So, there. Just an example of foods that are very good in blocking estradiol would be those that are what we call the brassica family, which is your broccoli, cauliflower, cabbage. These are rich in what we call DIM, right? So these can actually block estrogen from acting in the breast, in the ovaries, in the endometrium. So these are some foods that may actually block estradiol in the end, what we call end organs. Okay, so now in men, how to increase testosterone? There are actually a lot of herbs. I'm sure some of the men are very much aware of this. We have what we call the maca, we have what we call the ashwagandha, we have the ginseng. These are what we call testosterone, increases testosterone production. Okay, so but in some men wherein their testosterone is severely deficient, they might need some natural testosterone therapy. Of course, if you do want to take testosterone, estrogen, progesterone, or what we call bioidentical hormones, we have to make sure that you seek the right doctor, that you won't be harmed. Because if you give too much of these hormones, they become a harm also, right? So, if you're 70, is there some way? Of course, if she said if you're 70, is there some way to protection to protect yourself from osteoporosis or some form of cancer, strokes, and dementia? Definitely. If you're afraid of taking hormones, okay, we can still give you some what we call herbs, okay, or supplements that actually blocks estrogen from acting on the what we call on the end organs or the lack of estradiol. So we want to increase estradiol. Actually, in women, it's harder to increase their estradiols because the organs that produce the estradiol or the estrogen actually has what we call atrophy. So, but there are ways to protect your bones. You can take some high dose vitamin D, some magnesium. Okay, you can eat what we call yams. Yams have high amounts of what we call progesterone. Okay, so these are some of the supplements, that herbs that will actually prevent or protect you against osteoporosis. And of course, if you're already osteoporotic, you will need some form of supplemental calcium. Okay, calcium supplements. But if you're gonna take calcium, make sure you're also taking high amounts of vitamin, because without vitamin D and vitamin K, you won't be able to absorb the calcium. Okay, so a lot of women, have this idea that if you take calcium, that it will protect you from osteoporosis. No, it's actually vitamin D. You have to take vitamin D with vitamin K and some magnesium to protect yourself from developing osteoporosis. Okay, so. So going back to some herbs with estradiol that would help, help you increase your blocks. I mean, herbs that might block estradiol. Okay, would be your soy also, what we call phytoestrogen. Okay, your green tea. These are curcumin. These actually blocks if you have too much estradiol or estrogen. Okay, so one of the things also that we see a lot in women these days are what we call the polycystic ovarian syndrome, or the PCOS. Okay, actually, PCOS is a syndrome wherein women will have very long menstrual cycle. Okay, some of them have developed ovarian cysts. Some of them would have breast cysts. Some of them would even have thyroid issues. So this is very common now, polycystic ovarian syndrome. Again, the reason for polycystic ovarian syndrome is over-dominance of too much what we call estrogen. Okay, so we have to find ways how to block the production of estrogen, or try to mitigate, okay, or adjust the hormone production of progesterone, so that there would be a better balance between estrogen and estradiol. One way of doing that would be nice, would be actually acupuncture. Acupuncture actually helps in a lot of women who have polycystic ovarian syndrome. Okay, so as you can see from the background, that's Laguna de Bay. Okay, so again, for myoma, would you advise? Okay, if you have myoma, would be advisable to do an operation. Okay, If you have myoma and it does not cause any issues, okay, then surgery is not required. However, in women who have myoma and then every cycle, every menstrual cycle, you develop severe bleeding, okay, then you might have to do some operation to remove the myoma because it's causing too much bleeding. Okay, so I guess the answer to that, if it's causing too much bleeding, or it's starting to obstruct your what we call your urinary tract, or you're having a hard time peeing, then you might need to do something about the vein. Okay, but in general, actually, you don't need. Okay, is PCOS curable? I think cure is the wrong term. Rather than cure, as I'd say, is PCOS can be reversed. Okay, so that means the ovarian cyst can become smaller. Okay, your a woman's menstrual cycle can become regular, but of course this takes time. Okay, but actually the reason for PCOS is really there's just too much estrogen in the system, and sadly it's not the estrogen of the women. It's not the women producing estrogen. It's actually the pesticides, or what we call xenoestrogen, that's causing too much progesterone in the body. Or we also have what we call heavy metals. So like lead, cadmium, arsenic. This can actually mimic, or what we call cause your organs to think that estrogen is in the body. So what we call estrogen mimicry. So it's trying to mimic the action of estrogen. So when that happens, then your body starts saying, "Oh, estrogen is there. I have to follow what estrogen is saying." So that's why they develop what we call PCOS. It's not because women are producing too much estrogen. It could be because of the environment, what we call the xenoestrogens, right? Or it could be heavy metals. So these are things that are rarely talked about. Even some of the doctors are not aware of these issues. Also, a lot of women with PCOS have big problems with their thyroid. They're not aware of it. A lot of women have thyroid issues also when they are diagnosed with PCOS. So I think we have to balance that out. Not only to balance their hormones, their sex hormones, but also we have to balance their thyroid hormones. Okay. Will PCOS cause problems with being pregnant? Definitely, because if your cycle is very long, okay, then most likely you will have a hard time becoming pregnant. So that's why I said one way to address this issue actually is to do acupuncture, and then we can do some herbs and supplements to balance out, okay, to try to regulate your hormonal cycle to become more regular. Okay, but definitely it is doable. Okay. Lastly, I think very rarely talked about in men is when they develop low testosterone. They develop severe form of depression. So I think I feel bad for some of the men because they think they're depressed, but actually it's just because their testosterone, or the male hormone, is actually very low already. Again, this could be because of not only because the organs producing the testosterone has actually gone kaput, but also the presence of heavy metals. Can you believe that? Again, these heavy metals. So we have to understand the toxins in the environment are actually the ones that are making us sicker. Okay. So if the heavy metals in the hair are too low, do they affect the sex hormones? Okay, number one, a little backgrounder on heavy metals. So what are the heavy metals that are toxic? So you have your lead, aluminum, arsenic, cadmium, mercury. Okay. So one way of testing if you have too much of these heavy metals is to check your blood, your urine, or your hair. Okay. So Miss Laura is asking if your heavy metals in the hair is low, does it still affect hormones? The most important point I want to point out is even if your heavy metals in the hair is low, it doesn't mean that you don't have that problem with regards to that heavy metal. It could still be that heavy metal is in the bone, or in the tissues, but it's not showing up in the hair. Okay, so if your hair analysis show you that you have low, let's say mercury, aluminum, it doesn't mean that it's not there. Okay, most likely it's deposited somewhere else. Okay, so one way to make sure that you really have a heavy metal retention, okay, or accumulation is to do actually what we call provocation test, where we give a chelator, okay, so it tries to suck out the heavy metals, and then we check you really how much of those heavy metals are we really affecting our bodies. Okay, so it doesn't mean that if you have low or heavy metals in the hair, that the heavy metal is not a problem. Okay, so I think we have to make sure of that issue or that fact. Okay.
Thank you for listening to your Holistic Health Podcast. This is Dr. Homer Lim. Now, if you do have questions about your health or you would like to request topics for our next podcast, please do message us at our FB page or Instagram at Akesis Holistic Health, or you may visit our website at www.akesisholistic.com. Thank you again, and please do come back for our next episodes.